I'm going to have the joy to conduct an interview and a dialogue with Marcus, because Marcus was, in my opinion, the main initiative taker to write this book, and has been the driving force, even though I've been the editor and written a short chapter. And I've had the joy to try to conduct 11 different authors who all have a great part in writing this book. And we also have some exciting news, Marcus, that this book would be part of the course literature of the physicians program at Karolinska, right? Hopefully. But I want to start, Marcus, in your words, why did the idea of this book come about? Why do we need such a book?
Well, in my opinion, the book connects to a larger framework of activities across Sweden, a major impact initiative based on the Vinnova called Vision Driven Health. And one part of that initiative is actually communication and collaboration. And that's a crucial part, a key to going forward together with a number of stakeholders. And what we identified early on was needs to communicate in different ways to different stakeholders with different backgrounds. So what we try to do in this handbook is to basically tell the story of information-driven care and its different parts, because in information-driven care, the key is to join forces from different knowledge domains and different data domains, for that sake. And when you are supposed to do that, you need to create a common language. So part of the point with the handbook is to create and support that common language between the legal team and the data science team and the management and the clinicians. So it's a way of communicating in a way that we hope is accessible to a broader audience that need to get a little deeper into subjects that is not their everyday work.
We wrote in the book, I mean, I think you touched on a very important point, that information-driven care requires a change in culture where everyone has to accept that they're part of a whole rather than different decentralized specialties. And that's, I mean, that sounds like a big change. And hopefully this handbook can be a part of, if everyone can discuss it from different perspectives, almost like a professional book club. It can contribute to that. But I mean, you've gone through that change part of the journey, or a long way of the journey in Holland. Was that painful to you? Would it have helped to have this book for you when you started?
Well, certainly, and that's also how we try to fill it with information that we would have wanted when we started this journey that was actually took place in 2015. So we've been on this route for 6 years by now, and transitioning culture is a major challenge, especially when it includes a number of specialties and knowledge domains that usually don't meet. But one key notion of information-driven care is actually understanding that we are all part of a joint mission to deliver better health. And that applies to the legal team, the management, certainly the clinicians are used to it, but also data scientists that need to understand that the data is not there for its own sake. It's there in order to translate data into information and into new insights, actionable insights that will alter behavior so that we can provide better care. So that's the key. And we as a system need to provide better care and more fact-based care. And the fact is hidden in the data. So that's why we embarked on the journey.
Something that struck me when we started working together was that compared to the private sector, it seemed like your purpose in healthcare was much clearer, because after all, it's about providing health to citizens and patients. And I think that's also one key message in the book, that this transition needs to start from the patient need and the future delivery to the patient, not the organization itself.
Exactly, and that's an error that we sometimes in our cognition do, that we go to our work and we have a task and we work according to that task, but we don't think beyond that task. And it's important to understand that every bit and piece of a healthcare system, connected healthcare system, is supposed to be there to deliver either longer lives, better health, or a comfort in society, knowing that you can get help when you need it. And if you don't achieve that with either of the tasks, the millions of tasks we have in healthcare, you should not put your effort into that task. You should do something else. What counts is how the patient fares. And the patient rarely asks us as clinicians, what part of the organization are you in? Or how did you pay for this CT scan? They are interested in their health, and that's how it should be, and that's how we should deliver, not based on where we are in our situation, in our organization, or what task we have at hand. We need to make sure that it all contributes to the interest of the patients.
There's a quote in the book touching relating to this, and that's, there's a lot of accepted truths or myths in healthcare. I think that's very telling. I mean, I guess that goes for every organization, but could you just elaborate on that a little bit?
Well, yeah, and I think this is actually part of our cognitive and social biases that we all carry with us, that we have a world view, a cause and effect, a view of causes and effect that is comfortable to us because we don't need to question them. But when we question them and when we build on fact, we realize that they are not true. And if we are acting on the biases that we carry with us, we make the wrong decisions in the individual situation, but also on the managerial level. So we need to conduct myth busting. That's part of information-driven care. Questioning the dogmas in healthcare. There are thousands that, if not fact-based, they will jeopardize either the patient's health or the money that is invested in the healthcare system. One example that was very clear when we looked into it early on, this was 5 years ago or so, we looked into the relationship between the occupancy rate of the in-hospital beds and the chance of being admitted to the hospital. And the dogma was saying that, well, if there's a high occupancy rate, then there is less chance to be admitted to hospital from the emergency department. Okay, that's what I thought, so let's look into it. And there was no correlation whatsoever. And that is also part of the culture, digging into the data instead of continuing looking at the world, the healthcare, the way we were trained to see it, which is unfortunately not always true.
I think you underline a very important thing, and that is to dare to challenge the problem rather than just accepting the way we do it all the time. And I think, as you said, there's something that all humans are guilty of, like just falling into that comfort and accepting the way things are and not changing anymore. And I mean, it must be particularly hard for physicians who've invested a decade of studies into, oh, now I can stop changing. But how do you continue to change? And I mean, you can't put that responsibility on every single healthcare professional to just make that transition herself or himself. Who has the ultimate responsibility in an organization to make that cultural shift?
Well, management always has the responsibility of the organization and its output, and how questioning what we do is a very sensible thing to do. It's hard to do because it's comfortable to be in your comfort zone, and questioning that is not appreciated by all. But you need to create a leadership where it's okay to question things and ask, are you sure? How do you know that? And let's look into it now that we have the capabilities, because one thing that we built in this area was the capabilities to understand things based on the data that we collected in the warehouse, and also put a layer of very capable tools on top of it. So that's where we came into the AI world to apply more complex and multidimensional nonlinear methods. So it's both culture and technical at the same time.
So would you say that it's crucial for the ability to make this transition that management understands this and takes responsibility for it and not delegates it?
If they don't understand it, you should work somewhere else, I would say, with these kinds of ambition. And a managerial level that is not interested should not be in the management, because the train is leaving the station now, or is actually already left the station. And healthcare, the trajectories in healthcare based on the demographic development and what we can do for our patients is rapidly changing the playground for healthcare. And in order to meet this increasing demand with the resources at hand, we need to work in other ways. And that's basically the insight that came to us in 2015, and say we cannot continue with like a more of the same strategy. We need to do more for not less, but as much as we do now, in terms of resources. So that was actually the paradigm shift that was in our heads, and the rest is like history now. What do you need to do in order to shift this paradigm across the organization? Well, you need to have politicians on board. You need to have the senior management on board. You have to have key individuals on board. There are always people in the organization that other people listen to more, and you need to identify those and have ambassadors from all perspectives. And one repeating issue was like for senior clinicians to understand why data scientists needed to speak with them. That was like really, and when they didn't understand each other anyway. So we needed to translate, like using Google Translate, but it was not between English and Swedish, but rather than legal, data, and clinician-ish. I don't know what the language name is, but the talk of the clinicians.
Another quote from the book is, "Transparency is scary. Dead bodies or skeletons can fall out of the closet." And I guess one of the skeletons was the realization that admission and hospital bed occupancy, there was no correlation. But and I mean, that's uncomfortable and probably a cause for resistance to change for many to do something else and just keep discussing things. But does it become easier once you start finding skeletons and accepting change?
It gets easier when you accept the skeletons, because they are there. So the senior management needs to to say that, because an important part of information care is actually the transparency part, understanding what's beyond your own responsibility borders. So you need to show everyone with facts, with data, what you are doing and how you're providing. And everyone wants to be proud of what you do, but in our homes, there are always things that we don't show to the public, that we don't like. It was something that happened, and well, we got away with it, and it was no big deal. But these things these skeletons can come out of the closet once you start talking about all the facts available, all the data available, and showing them to everyone. And that is scary initially, and it's definitely scary if the culture is punishment for having those. But so one important thing is to realize that we are all imperfections, and we are, as clinicians, not far from perfect. We can't be perfect because we're humans. We cannot be machines, and we don't want to be machines. But so transparency, showing all these lacks of perfection, is scary initially, but not after a while. Once you the immediate response to the skeleton is, well, let's pick it up and work together to find solutions on how to tackle it.
I mean, one of the things that impressed me most of your journey is probably not that you actually built all this, is that you picked up the phone and called someone abroad in the US and asked for help and guidance, which I think is like ties back to that skeletons or vulnerability to actually dare to collaborate and work together on things. And that ties into a question from Malin in the chat. When do you think collaboration with industry is needed? I mean, because I know you've done this in Halland as well to fill in gaps of knowledge and expertise.
Absolutely, and we have several companies in the room today that we collaborate with, and it's all about, well, it comes down to utilizing the data, the information in patient profitable ways, and in doing that you need not only data information from all perspectives of healthcare, you also need the competencies from all perspectives of healthcare, and not all competencies can be found within your own organization. If you do that, you're unique in this industry, I can promise you. So you need to look for skills and capacity and competence wherever it can be found. And sometimes you find it in academia, sometimes you find it in your own organization, and sometimes you need to collaborate with life science industry, pharma industry, medtech industry, or wherever you find the skills that are needed. So it's important to create a area where that collaboration can take place without being questioned or being untransparent. So you need to build trust around these border crossing collaboration, and that's part of the cultural journey, but also the legal journey. You need to understand how you can do this and tell everyone how it's done in a safe way. And we spent so much time on safe data access, integrity issues, data quality, who can make money on what. That's a very sensible question and sensitive question in some areas. So you need to sort all these things out in order to make your different stakeholders feel safe in the area.
But it sounds like you have a lot of experience and learnings that if you're in another region, you should probably call you first and learn before just reinventing the wheel, doing it yourself.
Or maybe read the book, because the number of talks we give at this point is, glass cup is pretty full. But
and we are also launching the book as a more condensed version, a digital version, where we're actually also using AI and adaptive learning together with Sana Labs. So you will be able to have the contents in your telephone with quizzes after each chapter or section in the book. So that will also be distributed on the 5th, when we have a longer webinar around the book and a panel discussion. I want to tie back also to actually the Swedish Medical Language Data Lab and the context we're in right now, and bring you out of your physician's role, because I know you have a lot of responsibility in what you say. But if you allow yourself to dream like 5-10 years ahead, when we have all the infrastructure in place for information-driven healthcare, and we have a competent language model or a medical language model in production where you can use data, what could you do with that? What's I mean, from your perspective and maybe from a patient perspective?
Well, from a management perspective, a clinical management perspective, the sky is basically the limit here. What we have shown that is that it is possible to use very advanced models in order to increase patient safety through a couple of cases, and in 5 years, or yeah, hopefully 5 years, maybe 10, but I'm sure that we will have real-time patient safety, or rather healthcare quality monitoring systems, automized, supporting us in finding the patterns that predict adverse events and bad outcomes, and of all kinds. And these bad outcomes are certainly injuries in healthcare that we want to avoid: falls and pressure ulcers and infections and all that, but also patient care that is suboptimal, and that can be found anywhere. So a systematic and healthcare system-wide monitoring, or even a quality assurance unit that alerts the management where that some trajectories are pointing in the wrong direction, but also on the individual level to support the nurse or the doctor, saying, hey, you think a little bit more about this, and in a farther future where the regulatory framework has been developed enough, you can always also maybe let these this support systems also act on that information, and hence reducing the number of working hours, making hopefully nurses and doctors come home earlier to their children.
Thanks. Where are we right now? I mean, are we at the forefront of this digital healthcare, information-driven healthcare, or can you actually get more advanced, more holistic, digitally AI-ready healthcare elsewhere in the world?
Well, I would say we in this room today are working on cutting-edge cases, definitely in a European perspective. There are some very good competition in the US and in forward-leaning healthcare systems today, but I know that should not be regarded as a problem. It should be regarded as an inspiration, because they are often happy to share, as we are, and we are all in this to bring better healthcare to patients, and And so this community is often very open-minded and ready to share and spread and scale good ideas. So bringing ecosystems where that is readily done and easy to do is one of the things that Vinnova is actually investing in right now, building these this ease of communication and collaboration, and I think that's a really important way forward.
I think that's a super important message. I mean, I agree with what I think you're saying. Being best is not a goal in itself. And if you're not the best, you can learn from the best and get to the same point faster. And there's probably clinics and research labs in China that are better at certain things, and in the US at certain things, and they need help from us in other areas. And if we collaborate rather than competing for being best, then we can all get ahead faster. So I think that's super important. Another question from Justin Talgrenska is that AI skills and AI expertise are in high demand and difficult to find. How do you solve that problem if you don't have access to AI experts?
Well, we solve that problem by training new ones ourselves. Actually, we have an academia, an institution at the university where we train data scientists, but not all can do that. But I would like to add that you cannot start at the level of AI. You need to do a large number of things first. If you don't have the data in place, AI has no value. If you don't know what to use AI for, then it has no value. So if you don't know how to collaborate across domains, you don't have that culture, AI has no value. So I sometimes get questioned how we want to start our AI journey and how do we do that? And I often ask for very basic hygiene factors, like, do you speak with each other? Do you have a data warehouse? Have you heard about Python? So very, very basic questions when it comes to healthcare systems wanting to start their AI journey. So
yeah,
don't jump to conclusions. Start where you are.
Yeah, I think this ties back to what you said earlier. The management needs to take responsibility of this. And I think a lot of big Swedish private companies have taken the shortcut of hiring a data scientist and putting the responsibility on them to lead that journey. And so they don't have to take the responsibility. And we see a lot of big Swedish companies now having spent 3 years on projects that are super interesting from publishing paper perspective, but not actually changing the organization itself. So
or the management tells the IT department to start using AI.
Yeah.
And nothing happens. So, well, they're super happy about that task, but the translation into value does not happen that way. So yeah.
And I would like to demystify the AI bit. It's not that hard to train an AI model and deploy it. I trained and deployed a deep learning language model yesterday in less than an hour. The data infrastructure is much harder. And I would say understanding the business value and the culture change is exponentially harder. That's the hardest bit of all.
And actually that has changed over time, because 5 years ago when we started deploying AI, the AI part was super hard, at least for us. Now there are so readily available tools, and also understanding AI makes you realize that it's an array of tools where there are very simple ones, understandable, transparent, explainable ones, but there are also opaque models. And you don't need to go for deep neural networks, investing in like GPUs for millions. That's not where you start. You start with the stuff that you understand, and then you build gradually on the complexity. And you need to have that understanding, not only with yourself or in the IT department, but in all stakeholders, to feel safe. Because one criticism or two on AI is the opacity. So we don't understand why things happen, or why we got this alert, or what is the cause and effect here, and also the hype around AI. But we at least in our environment has gotten past the hype peak of the hype cycle, and now it's more down to the hard stuff, like the core of actually getting things done, and that's harder than deploying a readily available model that you can download from a open site today.
I'm going to ask a question related to that, a concrete question, and then followed by a scary question. The concrete question is, now when you're working on your AI journey or your information-driven healthcare journey, are you setting concrete goals? Like 12 months from now, we want to be able to achieve this.
So I would like to say yes. Well, or actually, yes, we set goals, but yeah, we never reach them. We never reach exactly that goal or exactly at that time. So, and I think one important thing here is to be humble. You always run into obstacles that you did not know existed. Building trust in development, like knowing where you want to go. You want to improve health, increase lifespans, and increase safety. That's like measurable stuff. But how to get there is not that clear. And if you put very specific goals, there is a large risk that you miss the value of the journey, because these journeys are learning journeys, and you learn so much along the way that might be more important than the goal itself. So the ecosystem that we built with legal framework, regulatory framework, and hardware infrastructure and skills, etc., it came up, it evolved based on a number of case projects where we understood gradually what we needed to do. And we didn't reach in every case the goal we set out, but we increased value much more than we expected before we started the case or the process itself. So, and realizing that you need to be an eclectic thinker, a exploratory researcher, and an iterative analyst that's not the way we usually work in public funded healthcare in brick wall buildings. Humility and humbleness is like very important going forward, and saying I'm sorry, this didn't work is also a very good phrase to train.
Yeah, I think that's a really a good message. I think that goes back to what we discussed earlier. I mean, my takeaway from that is we need to set goals, but it's okay when they change. Because
they always change, because reality changes. So, and every prerequisite change. So, and the surrounding world change. So we are, who said Panta Ray? That's like, you can never step in the same river twice. And that's kind of the environment we're working in. Technology develops, our minds do not, but everything else does.
I'm going to ask a concrete question about data and regulatory frameworks. And Ulrika, you'll have to just step in once you want to take over and ask your transitional question. But I mean, we both have Garmin watches and measure our pulse every day. I have a DNA test online that I can access. I measure my metabolism every morning.
You're weird, Kai.
When can I start transacting that data with healthcare, and will that happen at the same time in all of Sweden, or will I be able to do it with Region Halland first? And
you're welcome to start paying taxes in Region Halland. But so there, what you're speaking about is actually locked in data, and there are so many ways that data is being locked in. There is the data infrastructure, how it's stored, and there is no standards that are decided upon nationally today that are good enough. The other one is the regulatory locked-in syndromes, and then there is the prestige. There is invented by me locked-in problems, and we need to address all those in order to let your heart rate variability inform your future medication when your angina is approaching your coronary vessels. So, but it will happen gradually, and what would push it the most is actually patients asking for it. Yep. And telling politicians and clinicians that this is what we want to have done, and that will push development forward. This is why we go to work.
But in order for patients to ask for it, they need to understand what can
that
be
it actually can be done,
yeah.
and what it could lead to. But I think that realization and that insight is growing in society, because we're getting more and more used to utilizing information for different purposes, and why not your own health? Maybe the most important perspective of your life.
Yeah, I think that's another perspective. I mean, in the book we have an illustration about Amazon, all the different services, and the patient, they don't consider healthcare as only the public sector. It's everything you get. It's your Apple Watch, it's your Garmin, it's everything, and you want to be able to use it together, and preferably give that data and get help from the top experts that are educated.
And information blocking is one of the major issues of the fragmentation of the healthcare ecosystem with this kind of wide definition that you just provided us. But we need to bridge it to reach further.
Okay, before I leave over to Ulrika, I want to just, and I'll let you give some final takeaways or messages. I want to ask everyone who's listening, please share the information about the book to your networks. It's super important that we share the understanding and knowledge about information-driven healthcare. And Marcus, what's the top thing we missed in this short conversation?
Well, 380 pages in the book compared to 30 minutes of talk. There's certainly a difference in information amount, but I would say that start digging into the subject, commit to what you want to have done, and don't wait with the start. There's nothing to wait for. The train is leaving the station, or already has left the station, but there's still time to get on it. Don't start with the AI level. That's where you reach once you have a number of hygiene factors in place already, and don't forget the culture.
Good, very good. Thank you very much, Marcus. I'm going to let you take over, Ulrika.
Well, thank you very much, both Marcus and Kai, for this interesting conversation and dialogue. And you will now get a chance